Hey, welcome to Golden Health Method. My name is Dr. Sean Golden, and in this video, we're going to be discussing potential negative effects of going on a low FODMAP diet. Now, if you haven't heard of a low FODMAP diet before, it's primarily used for those with different types of intestinal issues, whether it's Crohn's, ulcerative colitis, general IBS, just bloating, small bacterial overgrowth, a lot of different types of conditions people are now using a low FODMAP diet for. In fact, if you search online for some of the most effective or most common types of diets used for these intestinal conditions, a low FODMAP diet is one that will repeatedly come up. Now, if you don't know what a low FODMAP diet is, I'm not going to go over, exactly how to do it or the overview. That's for a separate video. But what it generally is you're restricting certain types of food components. They're very similar to fiber, and they feed the gut bacteria. And so these are food components that we consume with regular, even healthy foods in our diet that can feed certain types of bacteria in our gut and cause them to excrete certain wastes, maybe methane or hydrogen or other types of metabolic byproducts, or could cause certain effects such as bloating and other issues like that. So the concept is to limit those FODMAPs, those components of the food that feed these bacteria, so the bacteria won't get fed, and thus the side effects from that fermentation process, from that bacteria eating the food, won't happen because we're not feeding them. And what a lot of people find is it actually reduces their symptoms. And that's not just a subjective finding, but throughout many clinical trials, it's been found that going on a low FODMAP diet can reduce intestinal issues or distress, such as bloating, cramping, pain, just inflammation in general, which seems like very positive things. And so that's why many nutritionists and alternative healthcare practitioners are now prescribing low FODMAP diets for their patients. And sometimes that's okay. Often, if you're doing it in a properly designed way, it can work out just fine and you can end up better off than where you started. Now, the problem is when it's not done properly or it's done indefinitely, which unfortunately is happening more and more as people self-prescribe low FODMAP diets. The issue with low FODMAP diets is that it doesn't do our microbiome any favors. It can actually make our microbiome worse over time. And this is something most people don't know about. In fact, when you take healthy people and you put them on a low FODMAP diet, over time, their microbiome actually becomes more similar to a microbiome of someone with Crohn's disease. Obviously not a beneficial thing. And over again, not just in healthy people, but in those with IBS or who already have Crohn's or ulcerative colitis, studies are finding that low FODMAP diets worsen the microbiome. They very rarely or never improve the microbiome. And this is where the problem comes in, because you can see now that the low FODMAP diet is not a cure. It's not something that should be done long term. It's not something that could fix the problem. What it can do is it can temporarily lower inflammation enough, essentially just giving the gut a break, to heal up whatever it hasn't been giving the chance to heal. But if that's not the way that it's used, if it's used to try to fix your intestinal issues, it doesn't do a good job with that, because it's not something you should stay on indefinitely. If that's something you're trying to do, if you're trying to use a low FODMAP diet to fix your IBS or your gut issues indefinitely, what you're doing is you are going to get symptom improvement in the short term, but over the long term, you're worsening your microbiome. So whenever you come off the diet, you're not going to be at a better place than when you started. Your microbiome is actually going to be at a worse place. So this isn't a video to tell you not to ever go on a low FODMAP diet, but a low FODMAP diet always has a reintroduction phase after an elimination phase. So after you've been eliminating those foods, you do try to introduce them back into your diet. And this is when working with a health professional to do that is a very good idea, unless you really know how to do it yourself. Now, what I will say is you might not need to go on a low FODMAP diet in general, because a low FODMAP diet might not be the best solution. And this is where it really gets to the crux of the problem. A low FODMAP diet, again, is more like a Band-Aid solution because we're restricting certain things that are currently causing us issues, hoping that it's going to make improvements later on, when in fact it's worsening the microbiome over time. There are other options. To give you an example, there's another diet you could try, which is called the Mediterranean diet. And the Mediterranean diet has been compared against a low FODMAP diet and actually against the gluten-free diet for those with IBS, like Crohn's and ulcerative colitis. And what some studies have found is that a Mediterranean diet does just as good of a job at reducing intestinal issues compared to a low FODMAP diet or gluten-free diet. But the one benefit to a Mediterranean diet is that it is sustainable over the long term. Not only is it way easier to implement, because a low FODMAP diet, if you really are doing it correctly, is a very difficult diet to adhere to. It's very limiting. A Mediterranean diet is not limiting, and it's sustainable over the long term, and it's been shown repeatedly to improve the microbiome. The good species that the low FODMAP diet reduces, the Mediterranean diet actually increases. And the bad species that the low FODMAP diet increases, the Mediterranean diet decreases. So I'm trying to get you to have kind of a paradigm shift in your mind here. I'm trying to get you to look at things a little differently, not to look at just Band-Aid solutions or short-term solutions, but to think over the long term. The entire construction of your diet is very important for intestinal health. It's not just probiotics. It's not just fiber. It's everything that's in the food. It's the polyphenols, the flavonoids, the proanthocyanidins, the tannins, all of the things that give fruits and vegetables their color and their taste and their smell. What gives coconut oil its smell. Those polyphenols drastically influence the microbiome. See, when you eat processed food or refined food, you're missing all of that. You're missing all of those components that synergize in our microbiome. And that is really what the benefit comes from following a Mediterranean diet. If you haven't heard of polyphenols or flavonoids or any of what I'm talking about right now, make sure you check out my episode, it was either 2 or 3 episodes ago, about polyphenols and how they're one of the key components to a healthy diet, because I dive a little deeper into that video. But when you construct a Mediterranean diet, which I'm just using as an example of a healthy diet because of how well researched it is, what you're doing is you're eating mainly unrefined foods and you're limiting processed and refined foods. Because the processed and refined foods still has the carbs, still has the fat, still has the protein, but it's missing all of these wonderful diverse nutrients that are not classified as vitamins and they're not classified as minerals, but they're key components to a healthy diet. They synergize in the microbiome. In our evolutionary history, before we were able to refine food, just a little less than 100 years ago, or maybe around 100 years ago, never before that have we even been able to consume carbs without these polyphenols in there. This is how we've evolved our entire evolutionary history. And that's what's missing in our diet. So if we want to eat a healthy diet, a healthy, filled diet with good and healthy, unrefined foods containing all of these nutrients, that can do our intestinal system just as much benefit as a low FODMAP diet in the short term. But over the long term, one is deteriorating our microbiome and one is increasing our microbiome. So again, I'm not here to persuade you never to try a low FODMAP diet. For some of you, it might be necessary or beneficial to do a round of a low FODMAP diet. But what I am trying to say is that shouldn't be the first choice. Because if you haven't tried to create and sustain a Mediterranean type diet or paleo type diet, any whole food, unrefined, healthy diet that's been shown to improve intestinal health, that would be your first thing to go to, not a Band-Aid approach. Try going at the heart of the situation, not just trying to do a cover-up. So that's my advice for you today. I hope this was helpful. Be on the lookout for more videos like this, because in future episodes, we're going to be breaking down components of gut health. And it's going to be very beneficial because we're going to be breaking through some of the myths that are out there about how to actually have a healthy gut. Because so many people are struggling with IBS and Crohn's and ulcerative colitis and just gut issues nowadays. So stay tuned for those. And if you haven't yet checked out my new online course, which is specifically for Crohn's and ulcerative colitis, called Ultimate Freedom from Crohn's and ulcerative colitis, make sure you check out the link below. And in fact, I'm actually giving away as a freebie right now a 3-part video series where I give you 3 very important research-based strategies that are completely natural but completely based in research and clinical trials that have been shown in that research to increase the quality of life significantly of those suffering with Crohn's and ulcerative colitis. So this is completely free. If you want to check it out, it's in the link below. Make sure you grab that before it goes away. And until I see you next time, take care.